we look at this healthcare system, right, that is broken. And we often talk, guys, about there's no shortage of podcasts or people out there that'll tell us how broken the healthcare system is, right? This doesn't work, or this doesn't work, or we can't do this, we can't do that, or people don't benefit from it. And yet it's a really, really wealthy system, right? I mean, they're CEOs of hospitals, $10+ million bonuses, these massive insurance companies. It's a broken system that has only gotten wealthier over the years, right? And it's a system that really has pretty much been unchanged for 50+ years. I think you had the Affordable Care Act in, and I think it was 2008 or I forget exactly what year, but the Affordable Care Act comes on board, and that's a big change that mandates coverage for everyone. But I think at the end of the day, what I just love and what I'm so grateful to be a part of this team is, how are we taking tangible things and make them applicable to our membership, right? How are we truly benefiting the everyday families that are going to be Presidio members? And I think when healthcare has only become more expensive with less coverage, I mean, I think, Daniel, to have a program and a policy set up, with no copays, we see a product that has, the typical insurance product is a ton of copays, extremely high deductibles. In order to control costs, we really have created a society of uninsured people. I think, most families can't afford a $2,000 to $3,000 event in their life, 3-4 kids. One amazing thing about life, every guy on this podcast, you're talking about big families, right? And so you're talking about guys that have to look at their wives on a daily basis and make financial decisions that impact, how you live your life and whether you can go on vacation, do those things. And when you have an entire society of people that can't afford a $2,000 to $3,000 event, and we look at $10,000+ deductibles, you're uninsured, right? And so I think, when I look back, and I will always kind of, one of the things that drew me, other than just obviously the faith component of this, is at Presidio, we want to empower our people and equip them with the tools to give them an affordable health insurance option that actually serves them, right? And I think that, in the name of profits, in the name of, growing the bottom line, as these CFOs, it's pretty funny. We don't have a CFO on this call, right? We've got an attorney, an actuary, a sales and marketing guy, and a cost containment guy.
We wear multiple hats.
Yeah, exactly. One of us is the VP of T, and you'll have to learn that as you go through the go through the process with us. But I'll give you a hint: it's not the Bill Butcher. But yeah, I think we want to take Presidio to the people, and we want to empower our people to not have to budge on their faith values and the biblical pieces that none of us are going to budge on, right? But at the same token, we want to deliver a product that our members can use and they see benefit. And on my side of it, my little square, is going to be putting money back in our members' pockets so they can go use that for their family and for the kingdom.
It's funny. I think Daniel, you mentioned what an amazing mechanism health insurance is. And Alex, you mentioned how we want to build and add value to people's lives. And I think a lot of people's experience probably doesn't resonate with those two sentiments. It's probably like, I have health insurance. It's garbage. I'm frustrated with it. I don't get value out of it. So in a sense, and this goes back to the question that I was answering, Cameron, which is like, why has nobody done this? It's like everything is sort of teed up really well for this moment where, in a sense, the bar is so low in terms of people's expectations of what they can get and what value they get from their health insurance company. And we have a tremendous opportunity here to deliver a lot of value and to really exceed people's expectations with something as simple as like talking to somebody who understands what COBRA is when you call in with a question about your COBRA benefit. Like that's like it should be table stakes, but guess what? it doesn't always happen when you have a question about your health insurance.
That's a real story too of a major health insurer that one of us has calling into their call center. What's Cobra?
After what, 2 hours on getting
yeah,
kicked
that's
around?
right. Yeah. Yeah. And I think that's the value. Like, this is kind of why we wanted to do this podcast for folks. Like, I think there's this, people are kind of, there's this like mystical, like mystery about like, what is health insurance? They're just controlling our healthcare. They're just profiting. And we wanted to like put the veil back a little bit and say, welcome you guys into the journey. Welcome, Christians that want something that actually, aligns with their values and saves their family money, but also know who's behind it. So we wanted to, have that transparency where at the end of the day, a company, an organization, whatever you're forming, it's about the people that are at that organization. And that was, when Bob and I started, the first thing that we knew we had to do is, how do you get the best in the industry, not just from skill wise, but who are actually going to care about the mission, care about the people involved. And that's why we have Alex and Cameron here. And we're going to continue to grow that type of team that cares about both mission and the actual quality of the product. But that's really insurance is just statistics. It's just math. It's just about, having the right amount of premiums collected and reserves to make sure that bills are paid on time. It's just making sure that you do those things the right way. And, to the degree that people have abused it is because of the people that are involved. And to the degree that we can do good, it's going to be because of the people involved in Presidio and how we can use this company to actually promote the culture of life.
Yeah. And I love that, Daniel, with the transparency is, we're sitting here how many decades into health insurance, and it's so confusing. It's so murky. It's so this fog over it. Right. And the reality is that's intentional. And we are going to remove a lot of that from people so that you can truly see a transparent product and actually see how it works for you. I love making it transparent. Like we're actually going to do it.
Yeah. It's truly having, been in this space on the leading edge of a health insurance startup in the employee benefits space. I'm truly very excited about what we can do here and the opportunity we have to just, truly be different. We get to be different in the fact that we're going to be the nation's, first Christian pro-life health insurance company, which is pretty amazing to say. But the fact that none of anyone's premiums, and Bob, you started to hit on this, but like no one's premiums are going to contribute to abortions and services you probably are not value aligned with. It's a pretty bifurcated issue, right? 50% of Americans are pro-life, 50% are pro-choice, regardless of their religious affiliation. And to know that your premiums are not contributing to those services, where with most insurance plans, your premiums are contributing to those services. There are exceptions, and there are the Hobby Lobbies of the world, where plans are not paying for that. But I think that's a big win for
There's
value
literally
aligned.
a federal mandate that says
Right.
Insurance companies have to pay for it. So the exceptions are very small.
There's very few exceptions, but it's a huge win for those that are value aligned.